call the June 18th, 2025 meeting of the Board of Health to order. Mike, would you call roll for me?
Here. Here. You're fine.
Here.
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 Kirsten, right? Not here. Thank you. Next item on the agenda is the adoption of the agenda. Have a discussion. There is one item that we're hoping the board will add to the agenda for tonight.
I make a motion to add the grant application for the Jewish Women's Endowment Fund to the agenda. Second.
There's a motion and second to add that to the agenda. All those in favor, please say aye. Or
Aye.
Aye.
opposed, same sign. Motion carried. Do we need another motion to approve the agenda? You know, just adding that item. We're finding another motion or no? Okay, all right, thank you. Next item on the agenda is the approval of the minutes. Hopefully everybody's had a chance to take a look at the minutes and review them for accuracy. Okay, any comments or questions or motion?
I make a motion to approve the minutes.
Second.
There's a motion and a second. Any further discussion on the minutes? Hearing none, all those in favor, please say aye.
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 Opposed, say nay. Motion carries. Board President announcements. I do not have any announcements today. Other than I appreciate all the hard work that the leadership and the staff are doing dealing with this tumultuous times of budget realities. Next item on the agenda, Health Officer's presentation and report.
I would just like to highlight some aspects of the health officer's report. May was a new monthly record for the CHW's testing led in young children. 86 children were tested during the month of May, so shout out to those CHW's led team working hard to get the youngsters tested. Also to the EMBER program, which is our maternal infant health program, held at the Beacon on Tuesday evenings. It's an educational and support series, and it continues to grow. As of May 31st this year, we've had 64 unique women with a total of 460 pregnant and postpartum participants across all classes, the weekly classes and the support group since inception of the program in late September 2024. So we're very proud of those milestones within our care unit. The environmental team, along with the nursing unit and care unit, joined forces and had a lead conference in May. May. The program was a success. They did demonstrations on how to utilize safe lead work practices for home daycare owners who have homes who houses were built before 1978, which is the majority of the daycares that were present at the conference. They also offered free lead risk assessments to daycares if they were interested. Shout out to the environmental health septic team. They worked collaboratively with Camp Millhouse to get a new field system permitted and inspected before the busy summer season started. So those are some highlights and lowlights. I wanted to also give a shout out to our food services. They had 103 total temporary events. That is a 56% increase over the 66 total temporary events that they had the first 5 months of 2024. 45 of those events were held during the month of May this year. So they have been breaking a speed. They are really working hard. 24, there were only 24 temporary events that they had to register during the month of May. So everybody is working very, very hard. I just want to repeat that the lead testing is going great. 46613 has been our elevated zip code. It was elevated in 2024. It remains elevated predominantly. You can look at the graph and see for yourself where we're finding the elevated lead levels. The mobile team for the nursing unit provided educational sections for the Duke Center residents. They had mobile units at Stars Academy, Sisters of the Holy Cross, Duke Center, Briarcliff, and Goddard schools. Public health nursing followed up on 55 animal bites for the month of May and 34 communicable disease cases that we had during the month of May. So we are keeping very, very busy, and I'm really incredibly proud of the team. We have an incredibly talented and passionate team. I know you hear that from me often, but it's true, and that's why I'm saying that. So we're very proud of them and the work that they're doing for the county. Do you have any questions before we commence our spotlight with Vital Records?
Any questions from the board? What is the status of the food code? Is it now, has it been rolled out, or are we just kind of doing a soft start for the new code?
I don't know, Ms. Carolyn, do you want to speak to that? I know that the state, the regional representative from the Indiana Department of Health did come in and talk to the team about how it can be very overwhelming because they're trying to keep, they've got new forms, new codes, new everything. It's like learning a whole new alphabet.
Good evening.
The code actually rolled out on April 16th. For the first 6 months, it is more education than enforcement. Those are the guidelines from the State Department of Health. But we are, the code is the learning and educating and taking it slow. Like Dr. just said, all of the forms, the code itself, everything is changed. So kudos to the team. They are energetic, they are passionate, and they really don't miss a beat. So I'm really proud of them. They have. That's where we are.
All right, thank you. Good job.
And very patient because they have to go into food establishments and sort of sell.
Mhm.
It's like it's no longer a 113. It's now a ABC, and everybody's learning a new language, a new numbering system, and
Mhm.
the guidelines. So
Wow.
we have to be very patient to do the job, but also with our community members as well.
Mhm. Great, well, thank you. Any other questions on this month's report? Observations, concerns? Very good. Entertain a motion to approve. Oh, no, wait, we can do spotlight first?
That'd be great.
All right,
Thank
sorry.
you.
We can move to the spotlight. Hello.
This is our team. I don't think I've ever posted a picture of our staff, so if you guys ever see this, you can say hi. We went from 5.5 to 5. Again, as of Friday, South Bend is the only location to serve for both death records. Gratefully, we have a staff of 5 here because that is going to be overflow that we will be taking in from the Mishawaka office. You can see there we have Angie, who is our bilingual registrar. She's been in service with Vital Records for 5 years plus. Lisa Murray has been with the county for 7 years, 2 with us. Shannon is our newest registrar. She's a little over a year. And then Denise has 21 years with the health department, 6 with Vital Records. She is the assistant director, and then myself is 25 years, all with Vital Records. The next slide just a little bit of the updates. Our restoration project was completed earlier this year. You can see a picture of our books there. Those are the actual books that are in our vault, nice and shiny. We do expect that preservation to last another century at least, and I say that with confidence just because those records are electronic as well, so the need for us to go into the books is not great. But sometimes we still do human error with indexing, etc. So we do still flip through those pages occasionally. But the company that did restore them did an amazing job, so it was worth it. Also, an update to our paperless electronic application process. All of the hardware is purchased. We're waiting on our IT department here in the county to get that software navigated for us. They're having a little bit of a hiccup getting it to roll out the way we need it to. So as of earlier this month, we were kind of back to square one on that part, but they're confident that it is going to get done sooner than later. I think the biggest update is House Bill 1457, and just a refresher to that, that is the bill that was passed in 2003 that is allowing the counties to issue out-of-county records. So somebody that was born or died in another county by law is able to get it through St. Joe County, and that is across the state of Indiana. They have left that up to the counties to decide whether or not they wanted to participate. As of March, we were given guidance by the state to not do anything with that. In March, they dropped the bomb and told us we should move forward according to what our local health department wants to do. So we anticipate on participating in that for a couple of reasons. One, we're here to serve the community, and I think that is a great option to give people who are local here the ability to get their records from wherever they were born here in St. Joe County. Second, it will provide additional revenue to St. Joseph County, which we're grateful and desperately need. So sooner than later, again, we will be meeting with the admin and Marcel to put something together so that that rolls out to cover our butts for everything. It was a little tricky since we will be putting our health officer's signature on records that did not originate from here in St. Joe County. And then just the closing of Mishawaka. Again, everything will be coming to our South Bend office. All the internet, mail, and in-office requests will be coming through South Bend.
Excuse me, so are we completely done with restoration of the paper copies?
Absolutely, it's all
Okay,
good.
great. We don't have to talk about that for a little while. Excellent.
100 years.
I remember it was very expensive.
It was, and it actually completed under budget, so that was a good thing.
Right, great.
Yeah, it was over 125 books that got done, so it was a big project actually. And then just some of the services that we offer: the birth and death certificates, paternity establishment. Paternity establishment is via affidavit. There is no DNA testing or anything like that done in our office. Correction affidavits, again, done by an affidavit, signatures and payment, all done with the same appointment time. Genealogy is researching of death certificates prior to 1955, and then our notary. We do offer a notary in our office. So those are the services that we offer here, and then all of the things that happen in between, the court orders, the paternity orders, the legal name changes, all of those things also happen, but there is not a fee with that. Those are just done. So next slide. And then some of our goals. I think with Bill 1457, again, for us, that's probably the biggest thing that's happening with us is everything has to run mandated by the state for us, but that is probably the biggest change that we've seen since I've been in Vital Records. Lots of things could go wrong there, so that's why we're going to be very careful on how we decide to roll that out. We want to make sure that we ensure an accurate record to the customer. And because the state is going to be driving that machine, all of the records will be coming out of the state system. We want to make sure that we have a policy in place that gives us direction on how we obtain that information and send it back out. But with that, I do think there's a little bit more wiggle room on revenue on how we charge for that, because the process of it is not going to be the same as what we do now. We turn our customers around literally in 5 minutes or less. Take a lot of pride in that, and our customers appreciate that. But with this type of thing, it could be days, if not weeks, to get an accurate record. And because of that, I think there's a little bit of a wiggle room in how we can charge for that
Do you have a lot of people asking for that now?
every day. Every day. Elkhart and LaPorte, Marshall County, those are now Central County residents, vice versa. And just to add a little note to put something, like we've had Kosciuszko County, LaPorte County to begin issuing already. So they're taking revenue out of our county now. So we have to get that revenue back some way. So I do think that it is important that we implement that soon. Just because, especially death certificates don't go out by one, they go out by the dozens. And so that's $20 a record that we do. So I think it is important that we incorporate that soon. And just some ideas for other ways to generate revenue. Little simple things like cross the envelopes, things like that, that accommodate our customers if they ask for it every day. Just little things like that to help increase the way we serve our public. Other than that, that's it.
So when you had the fees up there, are those standard fees like from county to county or?
So in the state of Indiana, we have home rule. We can make our own fees. And for the larger counties, that is pretty standard. We're right there with the rest of them, Marion County, Hamilton, Allen. We're all pretty similar on what we charge. How we do it is another story, but that is, everybody's pretty similar in cost. And just to note, for people who think our fees are too high, it's optional. They can always go to the state of Indiana. You don't have to get service in St. Joe County. You're paying for convenience and you're paying for the efficiency that we roll out to you. Okay.
Could you please give us an example of accuracy issues where you have to investigate, like call downstate or call
Yes.
someplace? Can
For
you
the
just
new,
give us
for the
an
out of
example?
county ones, you mean?
Yes.
Yes. So, Drive right now, Drive is the software that the Indiana State Department of Health uses. I'll say they have about 75% of the records in their software. We can see those records, but even our own for St. Joe County, if the record is prior to 1998, half of the information is missing. So for us to print out of there, not only would we have to go and verify our own information, which is okay because it's at our fingertips, but when you're dealing with another county's information, we have to cross-reference with the state of Indiana and with that county to make sure that the record is accurate and no amendments have happened to that record. So that's a bunch of phone calling, that's fingers crossed that that county is willing to participate and even update that information in the system because the state is depending on them to do it. They're not doing the legwork. They might verify yes or no within a couple of days that yes, that record is from this county, but in terms of them updating the information, it doesn't happen.
So that's both for birth and death certificate?
So a death certificate is a live working record. I'm more confident issuing a death certificate from another county than a birth certificate because all the records after 2020 are live. So anything that is in the system now is the most updated record available for a death certificate. The last person that touched it, that is a live current record, and I don't have a doubt that that is the most accurate record if we did issue it. So I am confident to issue a record out of there after 2020 for a death certificate. Yeah, that's just for the newer births. You can say the majority of those may be correct, but again, if a parent went through child support court or had a legal name change done, it takes around 3 months to get updated in that system just because they're overhead. They don't have enough people to work that quickly there. For us here, we get a court order from our probate court. It's updated the same day we get it. It doesn't work like that for the state. And so again, like to make sure all of our T's are crossed, like it's going to take a lot of effort from everybody participating.
So what's the most common inaccuracy that you see with records? What are examples of that?
There used to be a point in time when I first started working here that the state would allow you to put initials for somebody's middle name. If the parent's middle name was Judith Ann, they would put Judith A. They would also do that to avoid having a legal name change or a court order put a correction affidavit put on file. If somebody's name had an E and with no E, they would abbreviate it. County of birth is usually missing. Sometimes the file date is inaccurate. Just simple things like that that are overlooked until it gets to the passport agency and your record is picked back because the information doesn't match with And again, I'm grateful for Shannon coming on. We anticipated this happening and she was brought on specifically to be able to help with that workload increasing.
So, for the-
One more note though, I do want to add that our revenue has increased over $60,000 in the first 5 months of 2025 compared to last year, just on that increase that we did to our fees over since last year. And anticipated to go over 100,000 for revenue final records alone from the fee increase.
do the out of county, requests, do they pay a higher fee or not? Because it takes additional
So
effort.
that was gonna be my proposal, once I get into the office with Dr. Marcel, is that we charge a $5 increase to our $20 just for all of the extra work that has to happen. It just seemed relevant to me. But again, that'll be a discussion that'll need to be had.
And we don't pay a fee to the other county, do we?
I don't know what the other counties charge. That's another home rule thing. The state is leaving that up to the other counties. I'm not sure. A lot of counties have a liability sheet that they're sending out with those records just to make sure the customer understands that that record was not originated in that county, that they are just the issuer of.
Okay.
So those are all the things that we'll be discussing before we move forward with it.
But I think.
We don't pay the other county.
No,
Yeah.
we don't pay them
And they don't pay
anything.
us anything.
So we're losing money for all of those people
Right.
that are going to other counties, so we have to get that back.
Right.
And then the health officer who is in the position of health officer at the time that the new copy is released, that's who signs the other county
Yeah.
certificate. So if it's incorrect, it's on me.
On now.
That's the liability part of it, and. Yeah. Any questions?
Any questions for Erica?
Thank you.
Thank you.
Thank you.
You didn't know it could be so fun, did you?
Sounds novel. Okay, at this time, could I get a motion to approve health officer's report?
I make a motion to approve the health officer's presentation.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item, new business. Item 2523, vote and discussion, job description, disease investigation specialist, immunization registrar, mobile. Who would like to?
I can speak to this. This particular position was the consolidation of two positions. We had someone that was doing disease investigation in the TB unit that was no longer with the department. And we had a person who was working part-time as a registrar for the immunization, the mobile immunization clinic. So we decided to combine those two positions. And the person who was doing the part-time mobile clinic registration agreed to take the position as disease investigation specialist for TB. So we made that a 3-day position and the mobile registration position a 2-day position. So basically we're trying to consolidate jobs. And so we took the two job descriptions, one as the mobile registration person and one as the TB and disease investigation specialist, and morphed them together.
And we already have somebody in that position.
Yes.
Okay. So we're just creating job description.
Description for that. person.
Gluing them together.
Gotcha. Okay. Okay.
Any questions? So there was two descriptions in our packet, I think. The one had a mobile and one doesn't. Which one are we,
It should be for the mobile,
the mobile? Okay.
yes.
I make a motion to approve item 2523.
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. Item 2524, vote and discussion, donation of items, member program.
This is basically the list of. Go for it. No, go for it. I'm glad. Happy to do it.
So this is a wish list of sorts for our affiliation program. Similar to the school health liaison situation where there was a created item that was very much needed in our community to work on involvement of school program. In this case, it's for expected mothers or new mothers. Our community. So these are a list of items with their specific link that was put together by our maternity health coordinator. So we're asking for permission to accept donations from this list in order to and also potentially rewards for participating in education.
So the donations can come from any citizen or group or anywhere in the country.
Any individual, group, organization.
Okay.
These are things that are needed for, pregnancy and postpartum.
Any concerns with that from the legal standpoint or? Okay. Great. Any questions? Comments? Sorry. If not, I'll entertain them. Oh,
So do we have this like a list somewhere so people know what we
Public facing.
That's the list.
Is that public facing somewhere?
We'll be using the exact same methodology as the school health liaison situation.
Okay.
So, this won't be, like, I think it's posted on the website.
It's posted on our website for the Amazon. It's an Amazon wish list, basically, for the care.
okay.
Like registries and weddings.
I make a motion to approve item 2524. Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. The item that was added, I presume, will be 25-25 vote and discussion on applying for a grant with the Jewish Women's Endowment Fund 2025.
Good evening.
Good
So
evening.
we're requesting your support to apply for a grant that we recently learned about through nursing school health liaison. The grant is through the Jewish Women's Endowment Fund, and potentially the grant could be in the amount of anywhere from $500 to $2,500. The deadline to apply for the grant is July 9th, which is why we thank you for allowing us to bring it to your attention tonight. The goal of the Jewish Women's Endowment Fund is to improve the lives of children and their health and women in the community. Our goal for this fund would be to use the funding to augment the existing funding for the community partnership fund that our school health liaison is for us. And so the goal would be to primarily use this for clothing needs for the schools, but it could also include hygiene, menstrual, or food supplies as well. And so we request your support to be able to apply for the fund or the grant.
Great, thank you. Any questions or comments to make? About the priority? Hearing none, I entertain. Oh,
Is this an annual opportunity or is this?
It is, according to the grant information, the intention of the grant is to be used, can reapply up to 2 additional years. But the idea is that the funding would be matched, which we have built into the fund because we already are contributing to it. The idea is to help either augment existing programs that fit into the fund language or to seed programs. In our case, it's a newer program that we're looking to continue. It's been successful. We're looking to continue that success and hopefully grow it with some additional funding.
The only caveat is they won't fund for more than 3 years. They have 3 years for the same program.
good start.
It is.
Any other questions? comments? Hearing none, I'll entertain a motion.
I make a motion to approve item 2525.
Second.
We have a motion and a second, 2 seconds. Any further discussion? Hearing none, all those in favor, please say aye. Opposed, say nay. Motion carried. So no old business. Public comment. Do we have anybody? Anybody on the list for public comment? Okay. Next item, time and place of next regular meeting, July 16th, 2025, 4:30, fourth floor chamber right here where we are tonight. Final item. Adjournment. Thank you, everybody, for coming out in this weather. Appreciate that. So we are adjourned.
Thank you.
Thanks.